An absolute pleasure to be here this morning, or we've just kicked over into the afternoon. We've had a really busy week at ISER, but really at the end of the day, everything we do as a community is trying to feed back into the breeders. So we're looking forward to also receiving your feedback over the day and how you can apply the things that we're all working on. So one of the small periods where we were away from science this week, we had the great opportunity to visit Palace House. And I'd actually, despite working here 18 years ago now for a season, this is a new establishment, obviously, and the paintings are amazing, and it really made me reflect a lot on where we sit in creativity as well. And it made me think of this image you can see here on the right. This is a pregnancy from a New Forest pony that was culled many years ago, and it made its way into our anatomy lab at the Royal Veterinary College. And it was photographed by Michael Frank, and in 2015 it won the Wellcome Trust Image Award. But one of the judges of this was James Cutmore, and he was a picture editor at BBC Focus. And I just want to read out his words when he commented on this award. He said, "It evokes many different emotions at once. It's fascinating, sad, almost brutal. Yet the subject is also delicate, detailed, and beautiful. The image shows us a large and magnificent creature reduced to a sad, fragile, and half-formed creature, which I find very humbling." So I'm sure there's many words there, particularly our breeders will sort of warm to or think about and reflect as you see this picture. And it really struck me as I read these words too about many of the reasons we do what we do. It also reminded me that biology is extraordinarily clever, isn't it? So one of the fascinating things about pregnancy that strikes me is that we start, and you can hardly probably see this, with this tiny little blastocyst over here. It's very, very small. And then over a very short period of 11 months, this rapidly grows, it differentiates, it forms loads of cells to form a very large placenta and a fetus. So there are a lot of events going on during this period. As you can see here, this is a day 33 conceptus, and this is a fetus here. And this is a section here through a day 46 fetus where all the organs remarkably have already formed. So I guess it's not surprising to us that sometimes these processes will go wrong and will result in pregnancy loss. So it is a real need for us to consider what is going wrong, why are these pregnancies failing. Also, I was really sort of communicated well to me was the word that this is very humbling. And I just like to up front to say I think it is very humbling to work on this because we're working really on a fascinating sort of area of science, and it's thoroughly enjoyable, but also from the perspective that we actually work with a large number of wonderful people. And I think to try and tackle these types of complex conditions, it really requires contributions not only from people in my laboratory, past and present, collaborators, but we also are working very closely with stud farms that are very kindly agreeing to access records, veterinarians here in Newmarket, and this has now expanded recently. So really, without all these people working together, none of this really would be possible. So what am I going to cover today? Well, I'd like to start with thinking about the impact of pregnancy loss on breeding operations. So why do we need to know more? We'll put it in context. Then I'd like to take you through some of our findings in early pregnancy loss. If you were here last year, we spoke a little bit about risk factors. I'll touch on that briefly. But what I'd like to spend a bit more time is some new data that we've just generated. Anna Kayla, who's actually up here at the moment, has been working on this just over the last month. So this is very current. And then I'd like to move on to the work on abortion. So let's put this in context. As a breeder, you cover your mares. You hope for this blastocyst, this to continue to develop, and ultimately producing a healthy foal that will make its way to the track, or if you're in sports horse industry, to competition. But inevitably, in a percentage of cases, this can go wrong. And we know from recent epidemiological studies, in about 8% of pregnancies, they will be lost before 65 days. and then between 65 days and term, we will lose about 5.5% of those pregnancies on top of that. So what does this mean? Well, there's the emotive things we just heard about from that quote from James Cutmore, but also in addition to that, there's the lost earnings. So you'll have a mare that's not producing offspring that season, the vet fees associated with it, more interventions for the mares, and then the sales process can be affected as well because of the timing of the year. So really, when we're thinking about pregnancy loss, we need to think about reducing the occurrence of that, and I like to think about this about managing risk factors, and we also need to think about diagnosing the cause of that loss. And one thing I really want you to all take home today is that pregnancy loss is an outcome. It's actually not really a condition or a disease in its own entity. It's actually an outcome, and underlying that are actually lots of reasons which are feeding in and causing that pregnancy to fail. So what steps are plausible to reduce the impact of pregnancy loss? Well, as I said, I'm going to focus on the cause and the risk factors. And the reason why we need to have a better understanding of the cause is we could take steps to reduce the chance of repeats in your mares. You can also put in mechanisms in place to reduce the impact on other mares in the herd. And you can manage breeding choices to minimize it occurring again. And knowing the risk factors allows us to minimize exposure to these risks, or alternatively allow us to think about herd composition and selecting maybe the mares that you want to keep in your herds. So this is where you would be with your veterinary surgeons and looking at these early pregnancies here, and you think, great, we've got a pregnancy. But, and this is what a healthy pregnancy would look like, around 33 days, but in many cases over the next weeks, these will fail. And this is when these are submitted to our laboratory by veterinary surgeons here in other areas of the UK and Ireland. This is what they look like when they fail. You can see here that these ones here have lost all the red blood cells. You can see sort of the vessels still here. This one you can start to see still some of the vasculature, and this one's quite degenerate here. So many years ago now, with the support of people up here, we went through a lot of clinical records to try and understand what was causing these to fail. And actually, what we found when we went through records of over 200 pregnancy losses, early pregnancy losses, is about 80% of the time we don't know what causes those. So this is the two sort of approaches we have been taking to try and understand that a little bit better. So the first is risk factors. So as I just mentioned, they help us manage aspects which can reduce the risk of EPL. We can then inform herd, and also can help us generate new hypotheses about what underlies these conditions. So we performed a study, and we reported some of this last year, and there's some other data from other groups in Japan that I've included here too. And there's really two main groups here that come out as the main risk factors that can be recognized for early pregnancy loss. On the modifiable side, so these are things that potentially could involve interventions. We found that drugs used to induce ovulation can decrease the risk of pregnancy loss. And I was quite curious to hear Sue's talk this morning about also thinking on the other side about the effects on the stallion, and I thought that's the flip side of the complexity of this. Giving flunixin at the time of twin reduction can also decrease risk. If they have endometrial cysts, they have an increased risk of pregnancy loss, and their body condition score between 15 and 35 days is very important, so it needs to be rising over that period. On the management considerations, we know that mare age, and this has been well shown over a number of years now, can increase the risk of early pregnancy loss. And as soon as they've had one live foal, interestingly, that risk goes up. So this is sort of a long list, and you're working in breeding operations, so you need to think, well, what does all this mean? What do I take away from this? So what I've done is put this into a table and to try and sort of bring that together. And so, for example, if you get a 5-year-old mare off the track, we're going to call her risk profile of 1. Just say you've got an 8-year-old mare and she's had one live foal on your farm, her risk has actually gone up 4.7-fold compared to this mare here, so it's already risen. And then if we look at our much older mare, a 15-year-old mare that's had, for example, 7 live foals and endometrial cysts, she'll have an increased risk compared to this maiden of 9.1, and an 18-year-old mare that's had 9 live foals might have an increased risk of 7. And remember, this is risk or sort of chance, probability, predictability, as Lee was talking about earlier. It's not going to, you will still have mares that will fall out of this. So how do we use these risk factors to manage pregnancies? Well, one thing that we could consider is concentrating on those mares at a higher risk. And so I know some of you on the farms here will be using Regulate, for example. This is often the sort of drug that people reach to when they're going to try and minimize this, mostly because actually there's very little data in the literature about what we can use to reduce the chances of these pregnancies to fail. But there's 2 things to think about these. I think first of all you need to think about which mares you use these in, and I think by looking at the risk factors you can look at which ones are at the highest risk. The other thing to think about, and the more data we've been looking at over the week at ISER as well, the more and more I'm thinking about how important it is to get, if you're going to use progesterone, to be using it early in pregnancy, not after your day 15 scan. So actually, there's accumulating data that would suggest that it's the progesterone in that first sort of 5 to 15 days that's really important. So if we're going to probably have an effect with this, it's probably if we're going to start supplementing them at day 5 through to 15 and not wait to see a small vesicle later on. And if you're going to do this in a very targeted, limited number of mares, it would be in your older mares. So if you do use it, do think about why you're using this. So what about causes of early pregnancy loss? Well, when I started on this about sort of 8 years ago now, we really knew nothing, and we hadn't really looked very closely because we thought these would just all end off in the fields. But we have, over the last years, identified 75 pregnancy losses that have been submitted to the laboratory that look like this. So we can certainly get them. So by looking at these, we can hopefully start to unravel the underlying causes. So what is causing the loss? So what I'd like to present today is a little bit of new data looking at fetal abnormalities. So in early development here, you can see this is a fetus at day 36, a normal fetus at day 36 and at day 40. And I always find this absolutely remarkable that at such a short period in gestation that you get all this fetus fully developed in sort of organogenesis complete. So it's just like a mini foal to many respects. And this is all happening when we've got a very primitive placenta in place. And we had a lovely talk at ISER this week from Graham Burton at the University of Cambridge, who works on the human placenta. And he hypothesized that actually they probably grow under a very low oxygen concentration in this early period to try and protect this sort of fetal development. So we wondered if some of these losses could be attributed to a failure of this fetus, so whether we were getting abnormalities in these fetuses and whether that could be associated with the loss. So we've been starting to look through these ones that we've banked over the years, and this is just some examples of things we've seen. We've looked at about 20 of these over the last couple of weeks. And we've already identified 4 gross fetal abnormalities from the ones we've looked at. We need to do many more. These numbers are very low, so don't write down percentages or anything like that. These are more examples of what we're going to find moving forward. But you can see here, this is a 58-day fetus that presented, and you can see here an abnormality with its palate here. So these are its nostrils, okay? This is its eye. You can see its tongue. So it's clearly got an abnormality there. We've also got, this is an example of 46-day fetus from the side. This is its eye here. And if you look, this is the eye here and over here. And you can see it's got a fissure. Can everyone see it's got a fissure sort of here where we haven't got fusion across the back here? We've also got, this is another example here from day 43. And you can see it's got a head abnormality here with its eye just here. And this example here at day 41, and we've looked carefully through this to make sure this is not a processing error, but you can see it's got its eye present here, but actually if we look on the other side here, there's no eye present here. So essentially by fixing these failed fetuses and being able to image them, we've been able to start to get a better idea about potential reasons why these are failing. So, but you know, the fetus have these abnormalities, but why are they occurring? And we think there are sort of two main sort of hypotheses around this. One is that there could be some underlying sort of genetic structural changes, so the genetics is affected early on in development, and they're leading to abnormal development of an organ or some of these more structural things I've shown you just now. Or maybe they've been exposed to something, we don't know what that is, during critical periods in development. So we know theoretically what we call teratogens, which are factors that can affect early development, are often exposures in early pregnancy that can lead to these more major sort of functional changes. So moving forward, we're starting to try and sort of address this first question here. What are the structural changes? And this is what we'll be working on the TBA-funded project over the next couple of years. But we've got some sort of early sort of interesting data that I'd like to share, and this is regarding a couple of the conceptuses that appeared to have what we call a microdilution of the chromosome. So essentially, a little part, here's a little arm of the chromosome here, so a small segment of this, in some cases in the chromosome, can structurally change by being duplicated, or you could actually just lose that piece. And interestingly, when we looked at a couple of the male conceptuses only, so they'll only have one copy of the X chromosome, a small region of that X chromosome had been lost that encoded a particular gene called STAG2. And STAG2 is a protein that's very important in cell division, and you can see it forms a molecule here called cohesion. And essentially what it does to the take-home message is essentially it helps these chromatids separate normally. So what would happen then is if you have none of this molecule here, you could get abnormal cell division. And we do know actually from cancer cells that lose this gene, they can develop multiple errors in their genome. So it's early stages yet, but that's certainly something that we're chasing. So we're also looking under an Alvarado-funded grant at abortion, so at this much later period, and this is from 65 days to parturition. So I'd just like to share some of the data generated, early data generated on that project as well. So what we've been trying to do is look at what we call a population level. So there's a lot of data out there if you look in the literature about different causes of abortion, if you look at a diagnostic lab, but we wanted to look actually at a population level. And the reason for doing this is we can actually then compare different centers around the world, so try and understand what's happening here, in other thoroughbred populations in the US or Australia or New Zealand, for example, and then look at the variability and exposures in those different regions. So the population level, I think, can be very powerful in this regard. So when we look at the population that we studied here a number of years ago, we had 113 abortions, which represented 5.5% of established pregnancies. And then you can see here, of those, we had 50.4% where we could identify a diagnostic laboratory investigation. So they had been submitted to the lab and we found a report about that investigation using the local clinics. We also identified around a quarter where no abortus material was found. These were biased towards the ones that were a little bit younger. So these were taken all the way. The study period is 65 days through to term. So these are biased towards those. And then we had another 25% where we couldn't find any investigation recorded. So these could be some that aren't submitted to the lab, or they could also be some that have moved out of this population. And we are going to go to Ireland diagnostic laboratories and outside this country to try and track these down to make sure this is as accurate as possible. But if we look within the ones that do go into diagnostic laboratories, so it's sort of the 2.25% over here that is going over here, you can see that as shown previously in this population at least, the most common reason associated with abortion is pathologies of the umbilical cord. So there were 18.6% of this full population here that were attributed to umbilical cord torsions, 7.1% suspected umbilical cord torsions, and then 1.8% that were ischemic necrosis. We had 8% that were placental pathologies, so that included things like placentitis. A small number here of intrapartum stillbirths, and about 12% where there was no primary diagnosis. So there's a couple of things I think that is worth sort of reflecting on from this data. And the first is actually when they have gone into the diagnostic laboratory, they've got a diagnosis in a majority of the time. So a large number of these are quite rewarding insofar as we can identify a condition that is associated with that abortion. And that allows the veterinary surgeon then to be able to consider the management of the individual mare, but also at a population's level as well. So how do we compare to other regions around the world? Well, we're lucky enough this week to have an abortion workshop. So we had about 50 people working in this field, both practitioners and scientists who were at ISER to get together and have a discussion around this. And it was very interesting, the first of which is we identified quite a lot of regional variation. So if you speak to people working out of Kentucky, they report quite a lot of ascending placentitis and infectious causes of abortion, EHV and leptospirosis. So these were the three considered most common causes of abortion in their population. I should say that there is very little updated publications on this, so this was reported by the delegates. If we go down to Australia, to the thoroughbred population there, similarly they reported ascending placentitis and other infectious causes to represent about 50% of their losses. And then they see umbilical cord torsions as well, although probably intermediary to Kentucky and what we see in the UK. So I think it's worth just quickly looking at the gestational spread of these abortions and the diagnoses. So this is from 60 to 360 days here, and this is data from Jess Roach, who's working in collaboration with Alistair Foote at Rostow's laboratories. And you can see here, so these brown ones here are uncertain, so it seems the younger ones, the uncertain seem to fall with a bias towards the younger stages in gestation. The pathologies associated with the umbilical cord fall here, so they're the next most common group gestational-wise here. And then later on, we start to see a greater concentration of placental pathologies. If we look overall at the mean gestational age of the loss in both the umbilical cord-related group and the non, you can see there is a significant difference with the cord-related on average presenting much earlier, which I'm sure is what you've seen anecdotally as well. So the project we've got going on at the moment really, though, is focusing primarily on the umbilical cord torsion subpopulation within these abortions. And the reason being is when we started looking over the data for this, as I'm sure you know, located most of you here in this region locally, that these corded pathologies are the greatest cause of abortion here. But if we look into other regions around the world, this is not always the case. So there was a reasonably recent paper by Joan Carrick, who manages thoroughbreds in the Scone area in Australia. She reported 23% of her cases to be associated with umbilical cord pathologies. In France, this was a large study that looked over a number of years. They found 16.5%. This is a very old US study, but it's the only peer-reviewed one we've got, so it was 4.5%, although more recently, if you speak to people, they say it's a bit higher than that. So I'm really keen that we get some updated data over there as well to be able to do good comparisons. But really, it was this great variation that really stimulated us to try and understand this more, because we could learn a lot from this variation. The first thing, though, I think that came out of our workshop, which we all agreed on, is we need some better data. So we need some really good quality data to try and understand this variation. It could be just that we've got different collection methods. So that's the first thing we need to do is sort of an international approach. But we were also interested more locally at developing a diagnostic, or sort of a robust diagnostic criteria. And Jess Roach in the lab has been working with Alistair Foote on that regard and collecting these abortions associated with these cord torsions in a systematic way and looking both grossly at their features and also at the histopathology, so histologically, what changes we see. So we've got some data already on some of these gross features, which I'll share with you. We don't have any sort of robust histological data yet. But so this is a pregnancy we received earlier this year, very sadly, from a mare that died. So we've taken the opportunity to take some images of this to try and help you understand these structures. So this is the fetus here. This is the fetus wrapped in the sort of amnion here. And then you can see this part of the cord here. This is what we call the amniotic portion of the cord, and the amnion's here, and then this is what we call the allantoic portion of the cord. So when you see total cord length recorded, it will be for the full length of the cord, all these two portions. And what we found was that, probably not unexpectedly at all, but that the total umbilical cord length was different between the umbilical cord related and the non. And so this is sort of what we went in expecting to see. And this is also after being corrected for stage in gestation, because remember, these are actually younger. But what we were intrigued by is actually we found that these differences were only in the amniotic portion of the cord, so in this portion here. So there was no statistical difference in the length of the allantoic portion, it's just in the amniotic. So this has led us to start to develop new hypotheses about what this is sort of causing this. Could it be, and it would suggest that the fetus is actually twisting sort of inside the amnion. Why that twists, we don't know. We don't know if there's an underlying pathology or whether it's just that fetus has had a stressful event. And we had a lot of great debate at that at ISER, whether it was just generally a stress event that caused that fetus to twist, or whether there was some other underlying cause. And the only way we're going to, I think, start to address that is maybe start to look at different risk factors to try and help us understand that more. So risk factors is the next thing, but I didn't sort of fall asleep and forget to finish my slides here. Unfortunately, at the moment, we know very little about risk factors associated with this condition. So this has started on a couple of stud farms last year where we've trialled some questionnaires and data collection methods, and we're about to start data collection, we're in August nearly, so in August. So thank you to those that are involved in that project, and we really would like many more. So if anyone's willing to be involved, please do come and see me. And the idea of this project will be to collect a number of factors around the factors related to the mare, so inherent mare factors. We're looking at exposures during a pregnancy as well. And I'm inspired to look at weather by Lee. We're going to be looking also at stresses to see if there could be a link with stress as well, or some sort of acute stressful event. We also still, as I say, don't really know the etiology of this condition, so we're hoping by looking at the risk factors we'll start to unravel that. So moving on to the take-home messages, I think the first thing is we need to develop more data, so data is where we need to head in the future. The thing to remember is pregnancy loss is an outcome, not a disease. So by diagnosing the cause, we really need this to be able to move on and improve the management of our pregnant mares. And we're starting to get there, that should be ticked for both. So we're starting to get there with EPL, and we're starting to get there with abortion, but there's slow steps and we've got much to do. In regard to risk factors, we're now starting to really get a better handle on risk factors associated with early pregnancy loss, but that's still to come for abortion. We need to be aware, and we're going to have a great talk by Judy Caldwell-Smith later this afternoon about other causes of abortion in other regions, because I think unless we keep looking, we may miss some of these things at times. Umbilical cord torsions, as I said, remain the most common cause in the UK, but we still don't know the underlying etiology. And just to wrap up, I'd just like to say again, I'm very grateful for all the submissions that we've received in the laboratory. I think we are starting to make some real headway in this area, and we're welcoming the opportunity to continue to work with many of you, and we'd love to chat to you today about how we can work with you on this area. So I'm just going to do a bit of an unashamedly plug at the end about a new project too. So if you permit me just the last minute, I've been working with an epidemiologist at the college, Kristen Verheyen, and we got a grant a short time ago from the HBLB, which is looking at early life experience and at how it affects injury risk and performance later in life. So we're looking at recruiting some stud farms to be involved in this, because we think by looking right through this very early period, and again, Pascal Chapat-Palmer will talk to us about programming again later this afternoon, we can then start to understand some of the impacts of these later on. So thank you very much for your time. I don't know if we have time for questions. Thanks.